Hello, beautiful people. This is Tanya. I just wanted to give you a update on my surgery. So I did have the surgery on the 25th, which was last Friday. We were scheduled to be at the outpatient clinic at 5:30 that morning for 7 a.m. surgery. We got there by 5:22. Um, Everything just moved extremely fast. Okay, I mean it went to moving. After we did the check-in, which was around 6:10 ish, something like that. Where they uh, make sure you are who you say you are, get your money. They're supposed to be getting money. Check you in, verify your ID and all that stuff. Make sure that again you are who you say you are. And so they did all that, and by maybe 6:30, the nurse, the pre-op nurse, was coming to get me prepped for the surgery. And then I had told Sandra that, once I get prepped, she could come back to where I am and wait with me until they get ready to take me back to the operating room. So around, I'm going to say about 6:50, 6:45, 6:50, somewhere around there. They had given me they started my IV, and the anesthesiologist had came in, and he told me that what he was going to do is do a nerve block on my shoulder, and which he did. And so that was around. Then they left out. Then they came back in again around 6:50 ish or so. And the nurse told me she was going to give me something to help me relax. And the anesthesiologist told me that he was going to go ahead and start my nerve block. Okay. So sorry about the camera shaking, y'all, because I'm only using one arm. He started the nerve block, and from there, I pretty much don't remember anything. I'm out at that point. And that was, like I said, that was around 6:50. Now Sandra said they did call her around 6:50 and tell her that they'd already done my nerve block. And then she said they called her again about 7, a few minutes before 7, I believe she said. They called and told her that they were taking me to OR. 7:20, they called and told her they were getting ready to start. Then approximately an hour later, I'm gonna say about somewhere between 8:20 and 8:30, they let her know that the surgery was over, because it only took about an hour. Let her know the surgery was over, and they took me to recovery. And I guess I was in there for a minute, and then from there they took me to another room where I was in there, and they brought Sandra in to where I was at that point. And I think that was around, I don't know, I guess about 9 o'clock or something like that. So I was in there for a while, and about 10ish, they were letting me go. I was out of there. So it moved extremely well. I mean, well and fast. So I just want you to know, although we said we were going to take you along, we just didn't have time. Everything was just boom, 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 which I do appreciate. I do appreciate, because like most of the time when you go to the hospital, if you've ever been there for a surgery, you get there, you're sitting around for hours. So even if your surgery is scheduled for 7 o'clock, it might be 9 o'clock before they start, and you've been there since 5:30, whatever, 4 o'clock, whatever in the morning. So, like I said, by 10 o'clock we were released. Um, I had already gone and picked up my meds that I needed. They called me that Thursday before, so I went and picked up my medication. So I already had that. And like I said, because of the nerve block, I was in no pain. Okay, there was no pain. Now here's the thing about the nerve block, as they explained to me, it can last anywhere from 12 hours to maybe 20, 24 hours. You just don't ever know when it's going to wear off. But because my whole right shoulder, arm and hands were all numb, I could not feel anything. And the nurse said that when you start feeling any sensations in your fingers, because I think it starts from the fingers and its way up. She said when you start feeling any sensation in your fingers, start taking pain meds. So that's what I did. So I started taking the pain meds because, like I said, I had went in and got them, so I had them. I started taking my pain meds, and so now I take that along with about 6 other prescriptions that he sent me every 6 hours. So that's where we are now. Again, that was, like I said, that was last Friday. I feel great. Shoulder does not hurt at all. And today I decided that today is going to be the last day that I take any pain meds, because I have been taking them trying to get in front of the prescription. Now don't get me wrong, I have some nagging pain, but it's nothing that I feel that I need the strong narcotics that I have to do that. So that's why I said I'm not going to take any pain meds. In other words, there's nothing going on that I don't think that Tylenol won't take care of for me. Okay, so that's why I'm doing that. I do have an appointment this week, this Wednesday, starting physical therapy. So we'll be doing that. And again, if I can, I'll bring you along with me. I don't know if I can or not, but we'll see. If not, I'll try to explain to you what I did in physical therapy. So maybe this will help somebody. And I have an appointment, I think it's around the 11th of April with my doctor for my 2-week post checkup or follow up. And again, I will let you know what he says after that as well. So anyway, like I said, I wanted to bring you and I wanted to come back and bring you the updated information so you can know what's going on. Because there might be someone out there that's thinking about having the shoulder surgery or might need the shoulder surgery, and they're hesitant. I'm letting you know, as far as I'm concerned, it's the best thing I could have done. My shoulder no longer hurts. Is it discomfort? Yeah, for maybe the first couple of days, but right now I'm fine. The only reason I'm still working, let me show you. See my cute pajamas? See, I'm wearing an arm brace. I don't know if you can see that. Yeah. I'm wearing an arm brace because they have cut the muscles and some of the tendons in my arm. So they're waiting on those to heal. The shoulder is fine. It's everything that's around it that needs to heal. So I'm wearing this arm brace, and I have to wear this for at least the next 6 weeks. And I'm thinking, is there anything else I need to tell you? I think that's it. That's it. So the arm brace I'll be wearing, and I'll also be doing physical therapy. But anyway, just wanted to share this update with you. So thanks for watching. Don't forget to comment, like, subscribe. I can't speak. And leave a legacy. I'll see you in the next video. Bye.